This segment of It's About You is sponsored by Dr. Steve Marsh and Cleveland Smiles.
Certain places, including dental offices, have been allowed to open up again. But you may be wondering, just how safe is it to go and get your checkup? Joe Cronauer discovered some reassuring information.
Today, we're talking once again with our friend, Dr. Stephen Marsh, who is in his office right now. Doctor, I did the math on this. You've been working with WKYC Studios for over 25 years.
No, absolutely. And with some of the same people and some of the same producers.
Yeah, it's been a great relationship here. Now, as we look forward to getting back to a new normal, people are going to start going to the dentists a lot more now, not just for emergencies. Doctor, what should we expect?
Well, so there are a lot of things to expect. And again, it's a new normal. I would tell you before we even start, the dentists have been thinking about this for years. We've been using universal precautions for over 25 years. So we were, I think, ahead of the curve, very much so in terms of sterilization, gloves, masks, that sort of thing. But again, as you suggested, it's a new normal. So we thought we should talk about what can be done when you go to the dentist, what you want to look for these days. And I think the first thing is in the reception area, as you come in today, dentists are going to be taking, or assistants, whoever, will be taking with a thermometer, a view of what you're going to have in terms of your fever. Have you not had a fever? There's going to certainly, Joe, be new questions. So you'll fill out new health histories. We can expect that. We're also going to try and stagger patients so there aren't a lot of people in the reception area together. But there'll be questions about, have you been exposed to the virus, that sort of thing. And then when you go back to the treatment rooms, I think there are things that patients should look for. For example, all over our office, we have these Purell sanitizers, and these are automatic. Joe, you actually put your hand down and out comes the sanitizer.
See
So
that?
there's no contact at all.
Yeah, that's great.
Pretty neat thing. Again, as you go back to the treatment rooms, when you go to the treatment rooms, you want to see that all your instruments are packed and sterilized individually. The dentist,
Right.
of course, will be wearing gloves, as will the assistants, the EFTAs, the hygienists. In our office, in many offices, the dentist will then also have you wear a pair of sunglasses or some sort of protection. Again, it's less about patient to patient and a little bit more about patient to dental practitioner.
Right.
Additionally, Joe, the dentist, as usual, will be wearing masks, either this type of conventional mask that, again, we've been wearing for years, but all dentists today and all practitioners, again, when I say dentists, I mean the dental team, will be wearing these sort of shields. And less about the dentist transferring it to the patient and more so that the patient's saliva and the aerosol, so to speak, won't be getting on the dentist or the dentist team. So all of these things, Joe, in our office, we've been doing for about 25 years, and most dentists have been doing it that way as well.
I love the show and tell. I really do. I think it's wonderful because it does put me at ease and everyone watching right now, knowing that, okay, there's so many precautions. But like you said, Steve, these precautions were put in place in your world well over a decade ago. I think it's great.
Actually, 2 decades ago, when you remember the last big virus, and we very much quickly adapted to it, and we tried to do the same thing with this coronavirus.
Now, one of the things that we love when you join us is showing us your actual patients before and after. I love the transformation pictures. Do we have time for just a few? Can we do? Oh, yeah, yes, we can. Okay, who are we looking at here?
So, Joe, I wanted to talk about emergencies because that's the only thing we in dentistry have seen over the past 6 or 7 weeks. This is Richard, and he fell on a boat, a family boat. It was going in the beginning of March. He fell and broke off his upper front 3 teeth. And Joe, about 2 years ago, we did porcelain veneers and crowns to give him this beautiful smile. He actually came up from Florida to see me, and literally was the last patient I had a chance to see. Those front teeth have been exposed. Those are the nerves, what we call the pulp. He had 3 root canals. I had a specialist do that work. And then we rebuilt the teeth with some posts and then made him a provisional or temporary bridge. He was able to go back to Florida with his sister. And at the end of this coronavirus issue, we're going to be able to restore him with permanent restorations. And literally the last case I saw before we went on break.
That's incredible. I mean, talk about recent, and it's painful and both awesome to see at the same time. And we have time for one more.
So another patient that I saw just before Richard had walked around with his temporary bridge, and he knew things were happening, and he had gotten some decay underneath it. And that was not work we had done. I should mention that. And it had been done about 4 years ago. He walked around with it. It got loose because he got decay underneath, because it was, in fact, a temporary bridge. It allowed materials and food to get underneath it. And so he came in, he said, I can't live with this during this time. Just before Richard, we took off the temporary bridge. And what you're seeing on the right, the after, is again a provisional or temporary bridge. As we move forward in the next month or two, we will then establish a permanent bridge and give him a smile back. But we took out the decay and gave him something that he can function with and be careful with during this time.
You put it best. As we move forward, you know what? Maybe Dr. Marsh needs to be in your life. So if you'd like more information on Dr. Marsh and his team and what he can do for you, please, by all means, give him a call at 440-461-1003. And the website, it's perfect, actually. It's a great website name. It's clevelandsmiles.com. Doctor, thank you so much for sharing with us.
Oh, it was a pleasure to be with you. And again, I hope everybody, as you suggested, move forward into a new world that will be safe and happy.
Amen.
And keep smiling.
Amen.
Joe, Dr. Marsh, thank you. And now here's something that will